Have you ever wondered who's really on the front lines in the fight against cancer? You know, the image that usually comes to mind is this single heroic doctor, the oncologist. But the reality? It's so much more complex and, honestly, so much more collaborative than that. Today, we're going to pull back the curtain on the world of oncology and meet the entire team that makes this battle possible. So, let's start with the big question that's going to guide us through all of this. What does an oncologist actually do? Is it just one single specialty, or is there a whole universe of experts hiding behind that one title? Let's find out. Well, the short answer to our question is that oncologist is a surprisingly broad term. We're not talking about just one type of doctor. Nope. We're talking about an entire field filled with highly defined specialists, and each one has a really critical mission when it comes to treating cancer. Okay, so at its most basic level, the classic definition of an oncologist is the doctor who specializes in treating cancer with medicine, primarily what we all know as chemotherapy. But, as you're about to see, that's really just one piece of a much, much bigger puzzle. Modern cancer treatment really stands on three main pillars, and each one has a totally different approach. Think of it like a coordinated attack, right? First, you have the surgical oncologist, who goes in for the direct intervention, physically removing the tumor. Then you have the radiation oncologist, who attacks the cancer in a very localized way using high-energy radiation. And finally, you have the medical oncologist, who fights it on a systemic level, all throughout the body, using medicines like chemotherapy. But here's the thing. Those three specialists are just the core. Modern cancer care is rarely, if ever, a one-person job. It's a full-on collaboration of an entire multidisciplinary team, and this is where the story gets really fascinating. This team goes way beyond those main three specialists. It includes subspecialists like the gynecologic oncologist. These are doctors who, after all their training in gynecology, spend up to 4 more years just learning how to treat cancers specific to women. And then you've got pain management specialists and palliative care experts who focus on quality of life. Every single one of them brings an essential piece to the patient's treatment plan. This philosophy really says it all. We build a multidisciplinary team to offer our patients the best available treatment. The patient is right at the center of everything. This collaboration isn't just about being efficient. It's about making sure every single angle of their health and well-being is considered, ensuring the best possible outcome. So, to see how this works in practice, let's zoom in on one specific area: gynecologic oncology. It's a perfect example of how modern treatment goes way beyond just the disease to treat the whole person. This is what it means to treat the person, not just the disease. A gynecologic oncologist looks beyond the tumor to address the most personal parts of a woman's life: her hopes for future motherhood, her sexuality, the impact on her family, and even the effects of an induced early menopause. This is what holistic care looks like in action. That team-based approach is absolutely vital everywhere. So now, let's shift gears and look at one of the biggest challenges in oncology: lung cancer. This case is going to help us better understand that crucial journey from diagnosis all the way to treatment. To really get a sense of the scale of this problem, just think about this number: 220,000. That's roughly how many people are diagnosed with lung cancer every single year in the United States alone. It's actually the cancer that causes the most deaths in the country. And here's where we need to bust a major myth. Even though we all associate lung cancer with smoking, that's not always the case. In fact, there's a really worrying increase in non-smoking women between 40 and 50 years old, likely because of specific genetic damage in the lung that isn't hereditary. Treatment is a race against time and against the spread of the cancer. So after a diagnosis with a CAT scan, if the tumor is localized, the goal is clear: get it out completely with surgery. But if it's already started to invade the lymph nodes, you need a combined attack of chemo and radiation to try and contain it. And if the cancer has spread throughout the body, the focus has to change. Chemotherapy is no longer about a cure, but about prolonging and improving the patient's quality of life. All of this brings us to a point that is just absolutely fundamental in the fight against cancer. Not just lung cancer, but all cancer. The critical importance of time and early detection. The huge problem with lung cancer is that it's sneaky. The symptoms, things like a cough that just won't go away or some chest pain, unfortunately, they usually only show up when the disease is already pretty advanced. This makes catching it early incredibly difficult, but also incredibly important. So here's the big dilemma when it comes to diagnosis. For high-risk people, like smokers, a CAT scan can potentially detect the cancer in time. But for the rest of the population, there's no clear recommendation to get routine scans, which, leaves us in a really vulnerable position. Faced with this challenge, the most powerful and direct advice from experts is all about prevention. The recommendation is unmistakable, and it's the strongest tool we have. Absolutely no one should smoke. Not just to prevent lung cancer, but also cancers of the head, neck, and bladder, and a whole host of other diseases. So, what have we learned today? Well, we've learned that modern oncology is a highly specialized field where teamwork is everything. We've seen that the focus is no longer just on the disease, but on embracing the patient as a whole person. And, above all, that in this incredibly complex battle, time is our greatest ally. Early detection is absolutely crucial. And all of this leads to one final thought. We've gone from the idea of a single doctor to these massive multidisciplinary teams, from just treating a disease to caring for a person. So with this collaborative and human foundation, the question is, what's the next big breakthrough going to be in the fight against cancer? Thanks for joining us.